Is China secretly preparing for the next pandemic? You best believe that they are. According to reports, Beijing's top COVID expert, Dr. Zhang Wenhong, is spearheading research to explore how climate change impacts mutation and spread of infectious disease. Now, this is big. Remember, this is the same country that exported the Wuhan virus to the world. It's now scrambling to prevent the next global outbreak. According to reports, Dr. Zhang believes that as the Earth's surface heats up, bacterial, viral, as well as fungal infections will evolve, mutate, and spread to new habitats. What this means basically is that pathogens and their vectors like ticks and mosquitoes will obtain a more habitable land. And this will, in turn, expose animals to bacterial, viral, as well as fungal infections. Just take the United States as an example. The rate of new cases of encephalitis and Lyme disease, both spread by ticks, has significantly risen. In China, dengue fever caused by mosquito has sharply increased in areas where it was not found before. From tropical areas, it's now traveling up north. Across Southeast Asia and Africa, malaria is still thriving. It has still not been eliminated. What's behind all this is the question. No points for guessing. Climate change. Reports suggest that scientists hypothesize that the COVID-19 virus, which spread to humans from bats and their habitats, are also expanding. Dr. Zhang notes how as the Earth warms up and the ice caps melt, some species that have not emerged before may enter human society, including ancient species of bacteria and fungi. Coming back to China now, Dr. Zhang, who played a pivotal role in China's fight against COVID-19, is now collaborating with other experts towards building a global pandemic preparedness. But a global response requires scientists to work together and provide enough data, enough evidence and suggestions on preparedness. A goal that Dr. Zhang says he is working towards. Dr. Zhang signed a memorandum of understanding with the University of Hong Kong. As part of the project, experts in climate change, public health, infectious disease control, as well as public policy will be brought together for research. They will research, establish monitoring systems, discuss public policy. They will work with environmental experts and climate experts to conduct in-depth research on climate change and its impact on the spread of diseases. And as experts have been stressing since the outbreak of COVID-19, the key to preventing a pandemic is more data and routine surveillance. Dr. Zhang hopes that these efforts can help scientists discover alarms for incoming pandemics. They could serve as an early warning and hopefully trigger quick response actions. The top Chinese COVID expert said that a discussion between experts from multiple countries will be held the second half of this year. But there are challenges, you see, that scientists need to deal with. Beyond preparing to manage the spread of future outbreaks, scientists are also concerned with how climate change will affect treatments for infected patients. You see, antimicrobial resistance, that is when bacteria, parasites, viruses, fungi develop resistance to drugs that are meant to kill them, is a big challenge. Scientists worry that infectious pathogens can change and mutate over time, which means that they no longer respond to medicines that are meant to treat them, and this can cause infections to persist within patients and increase the risk of it spreading to others. In 2019, Zhang said that 1.27 million people around the world died directly as a result of antibiotic resistance. Dr. Zhang says that if there is one issue that scientists all over the world agree on, it is that by 2050, 10 million people will die of drug resistance annually. That, by the way, is equal to the number of people who currently die of cancer each year. All thanks to climate change, humans are becoming drug resistant faster than the rate at which antibiotics are being made. Currently, there is a lack of research on how climate change is affecting drug resistance. But according to Dr. Zhang, understanding this is the natural next step towards preparing for the next pandemic. According to the World Health Organization, an integrated global approach is the key. It includes researchers, doctors, government officials, world organizations, and global communities working together. And this is why the governments worldwide are of the view that it's not a matter of if a pandemic will happen again. It's a matter of when the next pandemic will happen. We are still coming to terms with the full scope and impact of COVID-19 pandemic. Are we really prepared for the next one? To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.